an application of easy Z-scores, imaging systems, and brain SPECT. So welcome, Dr. Nasreen.
Thank you very much. I want to share my computer.
Yeah, sure.
Thank you very much. And heartiest gratitude to Confrontiers and the organizer for giving me the opportunity to present our research work in such a prestigious event. Can you hear me, Sarma?
Yes, sure. Yes.
Thank you. Thank you. So the title of my presentation today, in differential diagnosis of dementia, application single photon emission computed tomography, brain perfusion scan with EEG's core imaging system. What is EEG's system? And Bangladesh is located in southern Asia and bordered by the Bay of Bengal. Myanmar bordered Myanmar to the east and India to the east, north, and west. And greetings from Bangladesh, a country of 140 million living within 147,000 square kilometers that has been successful to sustain its goal of ensuring primary health care and now is expanding its coverage into advanced healthcare. I'm working in the National Institute of Nuclear Medicine and Allied Science, the apex of nuclear medicine facility, the largest tertiary referral center in the country for nuclear imaging and radionuclear therapy. And near about 350 nuclear imaging was performed in our institutions, and also radionuclear therapy near about 40 in number. In early days of nuclear neuroimaging in Bangladesh, the history is started in 1997, and nuclear neuroimaging techniques have been used in Bangladesh for more than 20 years. I want to remember and honor three pioneers of the field from our country. Their guidance has brought us where we are now. Professor Dr. Mizanul Hassan, Professor Dr. Faridul Alam, and Professor Dr. Lutfun Nisa. They are equally guiding us till now. Now the global prevalence of dementia, number of people with dementia is representing in developing country, this pink color, and developed country, that is the blue color. And the number of patients with dementia in world, including Bangladesh, is predicted to increase several fold from the estimated in 2015. This is the status of Bangladesh. Now, a little bit about neurodegeneration. The term neurodegeneration is a combination of two words, that is neuro, referring to nerve cell, and degeneration, referring to progressive damage. The term neurodegeneration can be applied to several conditions that result in the loss of nerve structure and function. And this deterioration gradually causes a loss of cognitive abilities such as memory and decision making. Neurodegeneration is a key aspect of large number of diseases that come under the umbrella of neurodegenerative disease. This is the natural history of neurodegenerative process. This is the normal stage. This is the minimum cognitive impairment stage, and this is the stage of dementia. And if we diagnose at the stage of minimum cognitive impairment state by the brain SPECT or PET, then we can intervene the medicine, so the dementia process will be slow. Now, the background of our study is the application of EEG's core imaging system on brain perfusion SPECT images for quantitative evaluation of regional blood flow has attempted to explore the differential diagnosis of dementia with various neurodegenerative disease and to evaluate computer-assisted automated discrimination of early Alzheimer's disease from other type of dementia. And this retrospective study was done at the National Institute of Nuclear Medicine and Allied Science, Dhaka, Bangladesh, and patients with various neurodegenerative disease on the basis of clinical information, anatomical imaging, and mini-mental state examination score have undergone brain perfusion SPECT imaging with technetium-99 and ECD were included in this study. And EEG's version 3 was applied to the brain perfusion SPECT image DICOM data to quantify regional cerebral blood flow among the study population. By surface view analysis, we here also assess the different areas of cerebral perfusion deficit manifesting dementia. Total 58 patients included in this retrospective study, and the patient profiles are clinically suspected AD 30 in number, clinically diagnosed dementia 17 in number, clinically suspected movement disorder with dementia 0 to 5 in number, and clinically suspected dementia along with depression 6 in number. Brain perfusion SPECT was performed in 58 patients with clinically diagnosed various neurodegenerative disease with mean age 61.2 plus minus 10 years and mean disease duration since clinical onset of 12.3 plus minus 4.7 months. The result is showing decreased cerebral perfusion was observed in specific voxel of image for suspected Alzheimer's disease in 20 cases, that is 34%, and in frontal gyri insular hypoperfusion in 10 cases. Decreased cerebral perfusion also observed in occipital lobe and precuneus in 8 cases, and decreased area of cerebral perfusion is seen. Discrete area of cerebral perfusion were seen in 14 cases, that is 24%, and rest of the 6 cases showing normal blood flow. That is the pie chart of male-female ratio among our study population, and this is the pie chart of presentation perfusion deficit, that is 34% showing AD pattern in cerebral perfusion scan, 17% showing frontal-lobar dementia pattern, and 14% showing dementia with Lewy body pattern, and 24% showing discrete cerebral hypoperfusion, that is vascular dementia pattern, and 11% showing normal. I'm going to talk about little bit EEGs. The EEGs allows computer-assisted statistical analysis of brain perfusion SPECT images. We evaluated the diagnostic value of brain perfusion SPECT using EEGs in patients with various neurodegenerative disease, those manifesting dementia. And Professor Matsuda, he has been in NINMAS as an international expert for neuroimaging consultancy since 2017. He was the former Director General of Integrative Brain Imaging Center, Tokyo, and he is the inventor of this software. And application of EEGs with SPECT image have been performed for patients with Alzheimer's disease, dementia with Lewy bodies, frontotemporal dementia, idiopathic Parkinson's disease, and vascular Parkinson's. This image representing the pre-EEGs era or HMPO, and this is the image of EEGs surface view analysis. Now I am showing some important or interesting cases there. Representing the surface view and axial multi-slice image of SPECT spatial voxel of image analysis resulting perfusion deficit in frontal lobe in a 70-year male. Another case representing surface view and sagittal multi-slice view with specific voxel of image analysis resulting multiple area of perfusion deficit in 55-year male that is suspected vascular dementia. And another case representing surface view and axial multi-slice view with specific voxel of image analysis result moderately decreased perfusion in precuneus, parietal lobe, and Z-score in AD, that is 2.4, which is moderately suspected Alzheimer's disease. This is a case of 58 years female representing surface view of axial multi-slice images with specific voxel of image analysis, resulting significant decreased perfusion in area of parietal lobe, temporal lobe, and precuneus, and score is 3.9, suggesting significant decrease the area which are responsible for Alzheimer's disease. Another case, 54-year-old female with movement disorder, slurred speech, left-sided weakness with dementia, and CT scan of brain showing cerebral infarction in bilateral external capsule, left basal ganglia, and both paraventricular region, age-related diffuse mild cortical atrophy also showing. And hypoperfusion is seen in external capsular area, basal ganglia, and both parietal lobes. Both parietal lobes may suggest persistent supranuclear palsy along with early AD. Here another case with the marked hypoperfusion in occipital lobe, and posterior singular gyrate parietal lobe may suggest dementia with Lewy body along with moderate Alzheimer's disease. Another case, 65 years male with memory loss and cerebrovascular accident, MRI showing tiny microvascular infarction in left parietal lobe, and EEGs showing, after application of EEGs, the surface view analysis showing multiple focal area of decreased perfusion in parietal lobe, temporal lobe, and occipital lobe, with hypoperfusion in posterior singular gyrate may suggest vascular dementia. A 37 years old female with conversion disorder, visual hallucination, auditory hallucination, and dementia for 10 years. Multiple focal hypoperfusion area are seen in frontal lobe, temporal lobe, and parietal lobe, left occipital lobe, compatible with psychiatric disorder. Another case, it is 58-year-old female with history of depression, forgetfulness, and decreased vision and difficulty in walking. Brain MRI showing tiny microvascular chronic ischemic change in both cerebral hemisphere with cortical atrophy, and after EEG's application of brain SPECT diaphragm data, bilateral significant hypoperfusion is seen in parietal lobe, posterior singular gyrate, hypoperfusion in occipital lobes may suggest Alzheimer's disease along with hypoperfusion in both occipital lobe, that is Alzheimer's disease with Parkinson's disease or Alzheimer's disease with dementia with Lewy body. These are the differential diagnosis of these findings. So, the surface view analysis by EEG's application in SPECT data, we can assess the area which are affected by hypoperfusion. This is the features of Alzheimer's disease, and this is the features of occipital lobe, frontal lobe hypoperfusion or FLD, and this is the features of vascular dementia. There are the multiple hypoperfusion area discretely pattern, and this is also moderate Alzheimer's disease pattern hypoperfusion. So in conclusion, this was the first experience of application of EEGs in brain perfusion SPECT data in single institute of Bangladesh. An application of EEGs in the use of functional brain imaging to diagnose and differentiate dementia is becoming increasingly important during an era where therapeutic agents are being prescribed. The separation of the dementia such as frontal lobe dementia, Alzheimer's disease, and multi-infarct dementia have significant meaning in determining the appropriate therapies from which the patient is most likely to receive maximum benefit. And our collaborating institution is BSMAB, that is Bangabandhu Sheikh Mujib Medical University, and the Institute of Mental Health and National Institute of Neuroscience. These are the three largest institutions of tertiary center which those collaborating us for nuclear neuroimaging development. I'm here showing the poster presentations in last year in World Congress of Nuclear Medicine and Biology, which is assessment of severity of Alzheimer's disease by application of EEG score imaging system in brain SPECT study. It is the initial experience in Bangladesh, and also it's a published data last year, that is 2019, in American Journal of Psychiatry and Neuroscience, the differential diagnosis of dementia, application of EEG score imaging system in single photon emission computed tomography brain perfusion scan. So Bangladesh strives to succeed in the field of nuclear imaging by following the world leaders. I am highly acknowledge our team of neuroimaging at NINMAS and also the renowned professor from home and abroad for upbringing the nuclear neuroimaging at our institution. And I also acknowledge the Aegis Asia for continuous supporting us for development of our study. And this is some beautiful images of my country. So thank you very much.
Thank you so much, Dr. Nasreen, for your presentation.